Well, welcome. I'll be talking about, in quotations there, work-life balance for faculty in academic medicine. So for the next 15, 20 minutes, we'll go on this journey of what this actually is. So the objectives for today, number one, I hope to define burnout for you, talk about some factors that impact faculty wellness and burnout, and then we'll talk about how to create a values-based action plan for you and your own wellness as a faculty member. If you mentor other faculty members, something that you can encourage them to consider creating as well. So I want to start with the title, and I put it in quotations on purpose. And does work-life balance actually even exist? We hear it a lot. It's been a very popular buzzword for a number of years, especially during the pandemic. It's been definitely a buzzword. Research would actually say otherwise, that this exists, yet we hear about this all the time. Please strive for work-life balance. People spending a lot of time attempting to strive for this. But, I have a picture of silos here. It would be great if our lives worked in these silos, if you can compartmentalize personal life and work life and other things, put them all in these nice silos. But we know this doesn't exist. It doesn't work. People have tried it numerous times. And so what do we do besides strive for this, since we know work-life balance doesn't exist? And how can we help each other achieve harmony? Maybe work-life harmony is a better word to describe, or integration somehow. And so my hope today is to have a conversation about this with you all, about how to work towards integration and essentially finding what works best for you. So some questions I want you to ask yourself. Number one, why is this work the work that you do, whether it's clinical research, teaching, all of the above, administrative work? Why is this work important to you? And number two, what at the end of the day do you hope for? Those are some guiding questions that I ask myself, as well as encourage other faculty to ask themselves, because it can really help ground you in terms of figuring out if what you're doing is worth it or not, whether on a professional or personal or both level. So I want to briefly mention this book. I don't know if anybody's read this book. You can type in the chat box, yes, I've read Bowling Alone. No, I haven't. If you haven't, I'd highly encourage you to read it. It's a really awesome book. It came out years ago now, but essentially this book talks about the decline of social capital and social cohesion in the United States since the 1950s. And I think COVID definitely has illuminated that for us again, this concept of social connectedness and the decline of that, and how do we figure out how to do that. And so I wanted to mention this book because it came out before social media was popular. I think MySpace was around when this book came out. This is before Facebook came out when this book was released. And so I think it gives a really nice overview of some of the contributing factors to people feeling isolated, even if they're around people. And so I think this definitely applies to our work as faculty, given some of the uniqueness of what we do, and especially if your work is highly specialized, how feeling on an island can definitely be palpable for you, especially being in an academic health center. So our context for a lot of us, we're in academic health centers. And so, of course, we know that these are a bit different than your traditional healthcare clinic. We're doing a lot of things. Some of us are doing research. Some of us are caring for traditionally underserved or marginalized populations. Some of us have really extensive training in a particular area of interest, and so we're offering particular treatments, procedures, surgeries for pretty complex patients. And one of the hallmarks of academic health centers is providing service to our communities at large. And so we have the task to do many things. We have this overarching piece too of these multiple systems to navigate. Maybe you are part of an academic institution, but then your clinical work is done through another institution. So who do I ask for what? How do I ask for what? Who's funding this? It can get really confusing very quickly. So put that on top of feeling as though you're on an island, feeling as though I don't know who to ask for what, or I'm being sent in multiple directions to ask for help. And so I wanted to at least set the stage for us as we go into this topic of burnout. And so think about it. Are you an island? Maybe you have a great team, whether it's a division within your department or your clinic team, you feel you have support, but not everybody does. So one question to figure that out is, do you feel like you're on an island with what you're doing in your place of work? So another thing I'd love to hear from you all is what comes initially to your mind when you hear the word burnout. Maybe it was many of the things that I just shared on the previous slides, but I'd love to have you type in the chat box when you hear the word burnout. What's the first word that comes to your minds? Emotion. Oh, exhaustion. I love it. 2 people put exhaustion, fatigue, overload, irritation, defeat, overwhelmed. Exhaustion is coming up a lot here. Checked out. And I like indifference. Indifference for sure. Reduced empathy. That's huge for sure. Thank you. Thank you for that. Keep them coming if you think of other words for sure. A lot of what you all mentioned fits into the formal definition of burnout. This mix of physical, emotional, and mental exhaustion from just very demanding work situations. And many times they're emotionally demanding work situations. So what you all have mentioned is spot on with what this is. Some data that I thought would be interesting to share with you all. Some of the specialties from 2019 that report the highest levels of burnout are here on the screen. I'm in the Department of Family Medicine. I work in family medicine, so I highlighted those of us who are in family medicine, but you can see here some other specialties that are quite high. They just redid this study with 2021 data that was just published a month or 2 ago, and this hasn't changed, unfortunately. These same specialties are still at the top of being reporting the highest levels of burnout. On the other side, if you are interested, those who rate the lowest levels of burnout are here. And so public health, preventive medicine folks are doing pretty great, which is interesting. So I'd like to share both sides of the spectrum here with this. This is from 2021, who's most burned out? Women. That's historically moved in that direction for a number of years. Partly why this echo exists is because of that. This is one of many ways to mitigate burnout. What contributes to it? Number one, too many bureaucratic tasks. Maybe you can relate to this. Maybe for you, it's a different reason why you would say you are burned out, but it could be multiple pieces here. Spending too many hours at work, lack of respect. Those were tied at 37%, lack of respect from administrators, employers, colleagues, and or staff. So maybe you share some of the pieces here. Maybe it is different for you. How do we cope with burnout? The positive thing here from the data that they surveyed across the country, most respondents exercise. Almost half report they connect with a close loved one. But on the other end, almost half of folks said they isolate themselves, which we know from the social cohesion, social connection data That's not great to do long-term for coping and dealing with long-standing burnout, is to isolate yourself. Eating junk food, drinking alcohol were also up there as well. So what can we do? Some of this you might say, okay, I know this. And what? Some of this might be new for some of you as well. So I want to come from two perspectives: the macro system level of what systems can do to support faculty, but then talk about the microsystems level in terms of things that you can do for yourselves to help with feeling burned out, feeling overwhelmed. So from a macro system level, AAMC released this fantastic document called The Rise in Wellness Initiatives in Healthcare. We have seen a rise in positions for chief wellness officers, wellness this, wellness manager, wellness chiefs, and residencies. We're seeing this for some time. Even before COVID, we were seeing this, but definitely during COVID, we've seen a rise in this. So this report came out where they developed 10 recommendations for organizations to standardizing the characteristics of a wellness champion. That's another thing that is come up, is that agencies are creating these positions, yet the job description is pretty nebulous. So if we're going to do this, take it seriously and have a job description of what these individuals are to do. These are the other five. So then giving them support, giving someone a title with no power, as you can imagine, that won't really get us very far. So giving them resources, funding to actually do what it is that they can do to help the organizational culture. Evaluate what you're doing. Is this working? Have a comprehensive evaluation plan, and having ongoing assessments for individual well-being too. So maybe you're getting well-being assessments as faculty from your institutions. If not, maybe that will happen for your institution in the near future, but that is one of the recommendations. And then prioritizing it as a professional development goal. So having it part of your professional development plan as you meet with your division chief, your mentors, your department chair, whoever it is that you meet with regularly, that's a topic of discussion. So this is from the macro system level. But let's talk about the micro system level. It might be really hard to see, so I put the citation there. But this is another guide for organizations to consider when you're building a culture of wellness. So it gives feedback of how to mitigate burnout from that macro system level. So number 6 here, I'm pointing out, having quality faculty mentors. So not just having mentors exist, but actually training the mentors to be mentors. So that's one example. Number 4 here says lactation support. Having lactation support services throughout the clinic institution to support individuals who are seeking out those services. So these are some examples of concrete pieces organizations can take to help build that culture of wellness. So how about you on an individual level? Here's some starting points. Mentorship. I'm a big proponent of mentorship if you haven't figured that out yet. There's a lot of strong data that talks about mentorship reducing burnout, increasing your professional fulfillment, helping you if you are on that island. I've been on that island before. It's not a fun place to be. This can really help mitigate that. So mentorship is a wonderful way, a way, not the only way, but a way to help increase your connectedness and your sense of purpose in what you're doing. Professional and executive coaching is another piece. I don't know if anybody's had this before. You can type in the chat box if you've ever had executive coaching. I'm going through that process right now, and it's quite a rewarding process. And so it's targeted coaching to help maximize your potential as a professional. There's some sample topics there: leadership development, negotiation, setting professional boundaries. And so if you're not sure where to start with something like this, many professional societies have connections to reputable executive coaching out there. and connecting you to coaching firms who do this on a grand scale. And many times you can use your CME funding for this. So that's something else to think about if you've never done that before, if you want to target something that you'd like to develop. And then lastly, I'll talk about this value-based action plan here. And these are 2 questions that you can ask yourself as you begin to put one together. Essentially, is what you're doing getting you where you want to be according to what you deem valuable or what you deem important in your life? If it is not, are you then willing to try something different? If you're not willing, you can, close this talk and have a great day. My assumption is that since you all are here, you are wanting and willing to try something different for yourself. So I'm not going to play this video, but I wanted to bring it to your attention. It's called The Choice Point. It's a short 4 or 5 minute video that you can find on YouTube. That's a fantastic way to begin to think about what's important to you, what are your values in life, and how to actually begin to engage in those types of behaviors that are consistent with your values in a meaningful way that makes sense for you. So I wanted to bring that to your attention. Take a look at this video when you have a chance. And then again, just some reminders about values. They're the direction you want to go in your life. So I have the picture of a compass there as an example. Not a goal, but values. It's not something you can necessarily check off a list. It's something that you just continue to move towards in your life. And so your goals can be consistent with your values, but values in and of itself are a bit different than your goals. This is an example of an exercise I might do with someone who is unclear with what their values are, to give them clarity of what that is. So this is called the graduation or retirement party exercise, where with each of these areas, you describe what each area means to you: practicing medicine, your relationship with colleagues, friends, family, or your health or well-being. Some may be more important than others, but you get to decide what that is for you. And then it says, if you were at your own graduation or retirement party, what would you like to hear other people say about what you stood for, the mark that you left? Generally, what your behavior over the years demonstrated about your beliefs. And then based on that, this is the Bullseye Worksheet, where you actually place an X closer to the bullseye if you feel what you're doing in that area is consistent with your values, or outside of the bullseye if you feel, well, yeah, this is important to me, but honestly, if you were to walk around and follow me for a week, you actually wouldn't see me engaging with friends or family. You actually wouldn't see me having quality relationships with my colleagues. So it's important, but I put the X on the outside of the bullseye because I want to create a plan to begin moving towards the center of this bullseye. So this exercise, I believe you'll get this in an email with the slides. I would very, very much encourage you to do this. It takes maybe 5 to 10 minutes to do, to give yourself some clarity about where you'd like to start in your own plan towards building wellness for yourself, or what that means for you. So once you do this, post it. Notice if you are engaging in any consistent behavior over the day, which is awesome. The key piece here is not perfection, but really just engagement. That's really, at the end of the day, engaging in things that are most important to you as much as you can. That's really the take-home message of this. This last video, I would very much encourage you to watch. It's a TED Talk by Dr. Steve Hayes, one of the main researchers behind psychological flexibility, which values are very much connected to. It's about 15 to 20 minutes, but I promise you, if you haven't seen this, it's 15 to 20 minutes worth your time, where he shares his own story about how he turned some personal, quote unquote, setbacks and how that impacted his work, and how he used that to turn that into purpose for him. So highly encourage you to take a look at this. And then I'll end with this resource slide. These are some books that, if you are interested in building value-based behavior in your own life, or building flexibility for yourself, these are 3 books that I would highly encourage you to take a look at. If you just had to pick one book I would read Emotional Agility by Susan David. It is amazing. She wrote that book for those in business, but it applies to everybody. It's just an amazing book. So highly encourage you to check that out. So with that, I know I went over a little bit. My apologies, but I don't know if we have time for questions or if Andre, if you want to move into the case.